Hello, this is Dr. K. Paul Stoller, and this video is about a new analysis of CDC death certificate records that is raising urgent concerns about the long-term effects of mass mRNA vaccination. According to independent researcher The Ethical Skeptic, children born after their parents were vaccinated are now dying at a 77% higher rate than expected. For nearly 30 years, infant and child mortality in the U.S. had been steadily declining, thanks to better maternal and neonatal care. But beginning in 2021, that trend suddenly broke. Instead of continuing to fall, infant deaths flattened and then climbed. This shift coincides directly with the mass rollout of mRNA shots among women of childbearing age. Researchers point to two possible mechanisms: teratogenic effects, damage during pregnancy itself; transgenerational effects, genetic or epigenetic disruptions passed down through reproductive cells. The rise in child deaths isn't limited to one disease. The data show sharp increases across multiple categories: kidney failure up 135%, meningitis up 112%, sepsis and viral infections up 90%, liver and digestive disorders up 82%, respiratory illness up 54%, congenital malformations up 51%, heart and lung disease up 38%, neurological conditions up 37%. This wide-ranging pattern mirrors the disruptions already documented in vaccinated adults, suggesting that the effects may now be passing across generations. How was this signal detected? Not by raw numbers, but through deviation from trend analysis, a method that spots sudden breaks in long-standing baselines. The break point is crystal clear. Week 14 of 2021, right after mass vaccination began among reproductive age adults. From that moment, mortality among children aged 0 to 4 climbed sharply, well beyond ordinary fluctuation. Two risks now stand out: immediate teratogenic risk, where babies in the womb face elevated danger; inherited epigenetic risk, where even children born years later may be affected by their parents' prior exposure. The data comes straight from official CDC records. If these findings hold true, we are facing not just a temporary side effect, but a multi-generational public health crisis, impacting children who never received the shots and who never consented to the risks. An obvious question is why this vaccine is still being allowed for public use. This story is still developing. Stay informed, ask questions, and demand transparency.